Two Democrats are here tonight to talk about it. New York's Anthony Weiner and Robert Andrews from New Jersey. Good evening, gentlemen. Congressman Weiner, first off, do you support the bill that was unveiled today?
Well, I don't, because it fails on one important level of health care reform, and that is cost containment and choice. You know, you can tell the insurance companies are going to have all these new customers, but unless you do something to curb health care inflation, it's going to bankrupt the taxpayer, make it impossible for businesses to hire people, and also it's going to make the exchange that we're trying to create unaffordable for the uninsured. So it's a loser all the way around, and frankly, the only way that you really get a handle on this problem is by having some element of competition with what I have proposed, which is a single-payer plan like Medicare for all Americans.
A single-payer plan that would basically put all of the private insurers out of business entirely? I got you. Okay. Representative Andrews, are you supporting the bill unveiled today?
No, I'm not. I think Anthony's right that the core problem here is that the insurance companies really don't have to compete against each other for the business of the American people.
Why don't they? I thought that this, I apologize for interrupting, sir, but why is that? I thought it was setting up these exchanges and I could now, instead of buying only from an insurance plan in my state, I could go across state line? No?
Well, no, because I don't think there'll be effective competition under Senator Baucus's bill. It leaves the present insurance oligopolies in place. Now, the average market concentration between the top two companies in an insurance market is about 78%. Senator Baucus's proposal really does nothing to fix that.
I see.
And then let me just add one clarification, because you ask a question that's commonly misunderstood. You, someone who gets insurance from CNBC, your employer provides it, you are not going to be able to go into this public exchange. For about 200 million Americans, they're not going to be able to. That's why the president says most people that have their own insurance are going to remain unchanged. This is only for the people that are uninsured or work for small businesses who are not able to offer insurance.
Are you saying that that's bad? Because, frankly, if CNBC covers me, why would I want to go into that exchange?
Well, the problem is you don't have a choice. If your employer comes to you and says you have Blue Cross or you have Aetna, you don't have to walk away from that plan. You can't go and use the market forces to have someone compete for your business. There is no real effective competition for people that have insurance or people that don't.
Yeah, but Representative Anderson, if I just ask you a question first. Well, go ahead.
Could I ask you a question?
Yes, sir.
Would you agree then that, because what Anthony says is right, that the use of the phrase government takeover of health care is false?
Well, who says I agree that what Andrew just said was right is right? I mean,
can you tell us where he's wrong?
I think that the idea of a single government pay system.
Well, that's not what he said.
That actually is what he said when he first opened up the. Did he say he wanted a single payer system? I'm sorry, Congressman Weiner, did I get that wrong?
He did say that, but what he also said was that the bill before the House doesn't do that. Right. It says that if you work for CNBC and get your benefits like you do, you get to keep it. So is it a government takeover of health care or not?
Well, see, I don't understand, though, gentlemen.
Have you read the bill?
Well, wait a minute. Why doesn't an employer...
Have you read the bill?
Well, look, most of Congress hasn't even read the bill.
We have. Have you?
No, I haven't read the bill. I've read the highlights, of course.
But any government... Read it.
Any government insurance program, is going to drive out private insurance. I mean, the idea that somehow you have competition by including a government program when clearly that's going to be subsidized by taxpayers and therefore going to be able to drive all the private competitors out of the market, just like any time the government enters into a market like that. It is a joke to call competition.
Let the Congressman speak.
It shows that you don't understand how the bill works. The bill does not provide a government choice for you. It only provides for those people who are trying to shop on their own for insurance because they're not insured.
What's wrong with that?
Those people,
give them the same tax advantage. Give them the same tax advantage that the employer has.
The problem is not the tax advantage. They're an individual citizen. We all know that the market works, that if you are a group of 50, 60, 100 like Walmart is, they can negotiate for lower prices. An individual is powerless to do that. The government option is only going to be available as an option, as a choice, to those people who are not insured. It's not going to do anything to provide any competition for your employer at all. And I have to say something else. It is true. The president does not support my idea of Medicare for all Americans. But if you think government-sponsored single-payer health care is not effective, I would ask all my Republican friends, how come they so thump their chest about how they're trying to protect Medicare from any cuts?
Actually, I would like to answer that for the congressman. The reason I think, Congressman Weiner, that single-payer government is not an effective program is because we have that with Medicare for health care for the elderly. It faces a $38 trillion deficit over the next 75 years. It's going to spend $38 trillion more than it's going to bring in with taxes. How can that be an efficient system, sir?
Here's the problem. All health care has a financing problem. In fact, Medicare expenditures are going up at a slower rate despite the fact that they represent people who are over 65.
But answer my question, please.
Private insurance, which is your alternative, is actually running much more in the red, except they're passing along the bill to us and pocketing profits on top of it. So there is not a question about whether or not we need to get costs under control, but the plan does not do it. The Baucus plan does not do it, and even the public option.
On Medicare, how many of them would give it up? Why don't you ask your viewers to call in if they're on
free.
Medicare?
I mean, who would ever give up something that's free, even when it's inefficient?
It is not free. It is not free. Ask them that question. They pay premiums, they pay co-pays, they pay deductibles. It's not free. And frankly, ask them if they would give it up.
And it has a 4% overhead as opposed to a 30% overhead in profit that your insurance company is taking.
You know, I got to tell you.
Who can do it more efficiently?
I really think what we needed most of all in this country, though, gentlemen, was to cover the 1/3 of the 46 million who actually do want insurance but can't afford it but don't qualify for government aid. It was just that slice we needed. But now you want to fiddle with even insurance at private companies. And you want me to be able to undermine my own employer and go out?
Where do you get this figure that only 1/3 of the 46 million want to be
One of your
insured?
distinguished fellow members of Congress came on this show and said of the 45 million uninsured, 1/3 actually can't get it. 1/3 can afford it but won't buy it because they don't want it. In fact, let's go on to this next element. I'd like to know where you stand on this.
My question? Who was it that said that?
You know what? I have dozens of guests. I can't. You think you're winning the debate because I'm unable to name the congressman?
Here's the problem.
Here's the problem.
Please,
why don't we stick to the issues?
The problem is too much of this debate has been dominated by half made up, mostly made up, and completely made up.
Congressman Weiner, I resent that. I'm not making that up. We will find the tapes and I'll send it to your office, and then you can publicly apologize.
You might not have made it up. That doesn't make it any less wrong, my friend.
It's hearsay.
It's a member of Congress, and so he's no more wrong than you are in what you're saying, right?
No.
Everyone has a point of view.
Dan, this isn't about point of views. I'm saying that some things are made up. You just quoted something that's made up. That's the problem with this debate.
Well, how do you know I quoted something that's made up? I quoted a congressman who came on this show and said it.
Okay, well, you quoted something that is wrong.
Why don't we get back to the issues rather than the text? I'd like to ask
why don't we get back to
Congressman
the facts?
Weiner.
You just made a representation.
Congressman Weiner, I'd like to ask you, do you believe in mandatory health insurance and that I should be fined as a family up to $3,800 if I don't have it?
I believe that every American should be covered with health care.
You should not. Mandatory.
Here, hold on a second. Let me finish my thought. You should be required to get health care because your failure to do so passes along the bills to me. You don't have a right to pass those bills along to me. That's what happens when an uninsured person gets hit by a car.
Well, but 60% of personal bankruptcies every year are because of medical costs. And so the person who then decides not to be insured ends up going bankrupt. They pay a heavy price, too. Maybe that's enough of a price.
That's right. Except the problem we have right now, the uninsured are getting health care. Make no mistake about that. They're just getting it in the least efficient way possible, meaning pass along their costs to you and to me and to Mr. Andrews' constituents. That's the problem. Right. So you can make individual choices so long as it doesn't impact my pocketbook. That's why everyone has to be covered, just like everyone has to get automobile insurance.
Yaron, would you ask something to the congressman?